The science of HIEMT and how it works. High-intensity electromagnetic muscle therapy, HIEMT, leverages the power of electromagnetic energy to induce muscle contractions that are more intense than those achievable through voluntary exercise. This technology is based on principles of electromagnetic induction and muscle physiology, combining advanced engineering with clinical science to stimulate muscle growth, strength, and improved tone. Here's a breakdown of how HIEMT works and the science behind it. HIEMT uses high-intensity focused electromagnetic HIFEM fields to deliver energy deep into the muscle tissues. This energy, created by rapidly alternating magnetic fields, generates electric currents in the muscle tissues without physically touching them. The currents cause the muscle fibers to contract involuntarily, producing what's known as supramaximal contractions, which are much stronger and more sustained than voluntary contractions. Key points: electromagnetic field generation. The device creates a magnetic field that alternates rapidly, causing the targeted muscles to contract and relax. Depth of penetration. Electromagnetic energy penetrates skin and fat layers to reach deeper muscle tissues, engaging both superficial and deep muscle fibers that may be difficult to target through regular exercise. During a typical HIEMT session, the device induces supramaximal contractions in the targeted muscle group. Supramaximal contractions involve nearly 100% of the muscle fibers in the targeted area and are sustained for several seconds at a time, far beyond what is achievable through normal exercise. Why supramaximal contractions matter? Increased muscle fiber recruitment. Normal voluntary muscle contractions activate around 50 to 70% of muscle fibers, while HIEMT can recruit up to 100%, resulting in much more effective stimulation. Muscle growth and hypertrophy. The intensity of these contractions leads to muscle hypertrophy, growth, and hyperplasia, new muscle fiber formation, building both the size and number of muscle fibers. When muscles are subjected to these intense contractions, they respond by adapting to the stress, a process similar to the natural adaptation that occurs with physical exercise, but at an accelerated rate. The body's response includes both immediate energy consumption and long-term muscle strengthening. Key physiological responses. Enhanced muscle metabolism. To sustain the intense contractions, muscle cells consume energy rapidly, which helps increase their metabolic rate and endurance. Muscle fiber changes. The repeated contractions cause microtears in the muscle fibers, triggering cellular repair processes that result in stronger and larger muscles. Fat metabolism. In addition to muscle activation, the increased metabolic demand in the muscle tissue can lead to lipolysis, or fat breakdown, in surrounding fat cells, supporting body contouring and reduction in localized fat. Unlike voluntary muscle contractions, HIEMT induces contractions that are continuous and at a very high intensity. The muscle's physiological response includes not only hypertrophy, increase in size of muscle fibers, but also hyperplasia, increase in the number of muscle fibers. Muscle hypertrophy and hyperplasia benefits. Strengthen muscles. With hypertrophy, muscle fibers become thicker and denser, leading to increased muscle strength. New muscle growth. Hyperplasia contributes to a greater number of muscle fibers, which can improve overall muscle function, endurance, and resistance to fatigue. One of the distinct advantages of HIEMT is its ability to selectively target specific muscle groups, making it highly versatile for both aesthetic and therapeutic applications. HIEMT can be applied to muscle groups in the abdomen, buttocks, thighs, arms, and pelvic floor. Application in physiotherapy and rehabilitation. Core strengthening. Core muscles are crucial for posture, stability, and balance, especially in rehabilitation settings. Pelvic floor therapy. HIEMT has shown promising results in strengthening the pelvic floor muscles, which can aid with incontinence and postpartum recovery. Rehabilitation of injured muscles. For patients who cannot engage in conventional strength training, HIEMT offers a safe alternative to improve muscle strength and coordination. HIEMT is considered a safe and effective therapy for various applications, including muscle toning, fat reduction, and therapeutic muscle strengthening. The technology is FDA cleared and TGA approved for muscle strengthening and fat reduction and is supported by clinical studies. Clinical findings on HIEMT efficacy, muscle volume increase. Clinical studies indicate that HIEMT treatments can increase muscle mass by 16 to 19% on average after a series of sessions. Fat reduction. HIEMT can also lead to a reduction of fat in targeted areas, with studies showing up to a 19% decrease in subcutaneous fat following treatment. HIEMT is a non-surgical and non-invasive therapy requiring no downtime. Patients can return to normal activities immediately after a session, with most only experiencing mild muscle soreness, similar to post-exercise soreness. Non-invasive benefits. No recovery time. Since HIEMT does not involve surgery, incisions, or injections, there is minimal risk of complications. Immediate results with continued improvement. Patients often notice an improvement in muscle tone within a few sessions, with continued enhancement in strength and definition over the weeks following the treatment course. Electromagnetic energy creates supramaximal contractions, deeply stimulating muscle tissue. Supramaximal contractions activate nearly all muscle fibers, leading to significant hypertrophy and hyperplasia. Cellular adaptations to intense contractions increase muscle strength, size, and endurance. Metabolic effects support both muscle strengthening and fat breakdown in the treatment area. Applications in rehabilitation, physiotherapy, and aged care provide benefits from muscle recovery, injury rehabilitation, core strengthening, and mobility support for older adults. In conclusion, HIEMT offers a scientifically backed, effective method to strengthen and tone muscles, with significant applications in both medical and aesthetic fields. It has been widely embraced by physiotherapists, rehabilitation specialists, and aged care providers as a powerful tool for enhancing patient outcomes and supporting a range of therapeutic goals.